Assalamu alaikum to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm Fahad Matin, your host for today, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far and looking forward for a nice and chillaxing weekend. Yes, indeed. It is a very chillaxing weekend this weekend. It will be a very nice weather, alhamdulillah. So people will, because it's school holidays as well, so you can see a heap of people will be roaming around everywhere enjoying the break. This program is broadcasting live from the studios of Inspire FM today on 14th of August 2025. And the time just past 6 p.m. Yes, indeed, it's 14th of August. And it is also the Independence Day of Pakistan. We're casting our positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpeth and Bedford. Our positive airways reaching to all our listeners who are listening us through Inspire FM radio app or website, or viewers who are viewing us through Facebook and YouTube channels. Welcome. Now, NHS England always highlight the importance of vaccinations, especially when it comes to childhood vaccinations. And as you can see, a trend of the show in the last few weeks, if you can see, we have started a couple of weeks ago with the children's bowel problems. And last week, one of my colleagues has explicitly talked about other children issues where parents do get worried. So one of the other things which my colleague has touched last week was about childhood vaccinations. And yes, our topic for today, our focus of the topic today is childhood vaccinations and flu vaccinations. Childhood immunizations and flu vaccinations. And I am very delighted that we have two lovely guests in the studio who will be joining us today, and they will be talking us about their journey and their whole program, as in why this program is very important for all of us. So let me introduce our guests today. There are two lovely people who are joining me today, and it's a blessing that I'm not the only one who's talking about this topic by myself, because it is a very, very difficult topic when it comes in that sense. So joining me today is Mike Saunders and Rachel Turner, and I will ask lovely Dr. Mike Saunders and Rachel, I will ask them to introduce themselves and give a quick introduction about themselves. So how are you guys? And can you first of all welcome to Health and Fitness Show, and how are you guys?
Yeah, thank you. Lovely to be with you. Yeah, we're very well, thanks.
Pleasure. And it is a pleasure seeing you via the online link, although I prefer in person in the studio, but it is always a blessing to have a lovely guest like yourself present in front of us and discussing these very important topics. So as a part of a tradition of our show, we always ask our lovely guests to give a quick introduction about themselves, so we know, so our listeners can understand your name, your organization, your role in your organization, and a brief background about yourself. So let's start with you, Mike.
Sure. Yeah. Hello, everybody. My name is Mike Saunders. I work as a public health registrar with Rachel at NHS East of England in screening and immunisations. And I've been working in public health for a few years now in a few different organisations and different roles. And a few years ago, I used to work as a children's doctor, worked as a children's doctor for a number of years in the NHS at a number of hospitals in the East of England. So, yeah, thank you. Nice to be with you.
Thank you so much, Mike. And Rachel?
Yeah, thank you for having us. My name's Rachel. My current job title is Immunisation Co-ordinator for NHS England, East of England. However, I'm also a registered nurse, and and I still practice as a nurse as well, sometimes giving these immunisations. So yeah, that's my whole job role is centred around these things.
To be honest, giving children's, especially young kids, young children's immunization is a task, I must say. And being a father, I have seen it by my own eyes. It's not easy, to be honest. It's really not easy, and distracting them and making sure that they are cooperative. It's a talent of nurses, which they do it in a very unique way. A very unique way. So hats off to you for that, because to tackle the young ones in this professional manner is not a joke. So thank you so much for coming to our show, guys, and welcome to this show. I know it's your first time to be part of this show, but hopefully we will see you again in future as well, to both of you, and either on this topic or other topics as well, because this is part of our gig. Whoever comes here first, they normally come back again because they love it so much. So let's crack on with our show today. So tell us, what are vaccinations, and how do they work? Mike?
Sure. Well, vaccines are substances which teach our immune system, our body, about infectious disease. And there are different types of vaccines for a whole host of different types of diseases. And basically, it helps our body to recognize what different bacteria and viruses look like so that we stay protected. So that if we encounter these viruses or bacteria in the future, we can defend ourselves against them and stay well.
Indeed, indeed, and it is very, very important for these kind of things to teach our body, to help our body to protect itself. So, Rachel, have you come across any issues in your patients which you have to firefight these kind of situations?
Yeah, there's always lots of different sort of situations that occur with vaccination. In terms of the effects of the vaccine, so the main things that can happen afterwards are the sort of sore and aching arm that you might have had yourself, children feeling a little bit tired, having a headache, those sort of symptoms, sometimes minor colds after things like the flu vaccine. But in general, the side effects are very minor, especially in comparison to the diseases that they're protecting against.
Yes, exactly. And the beauty is when you're giving vaccines, it's very unique, because there are different age groups, and there are different times when you have to give immunizations or vaccinations to those children. So which vaccines can be given to children's or children can have, and at what time, which you come across, Rachel?
Yeah, so vaccinations start from pregnancy with mum, but officially with the baby when they're 8 weeks old. Then they're given again at 12 weeks and 16 weeks. The key ones at that age are to protect against things like tetanus, polio, diphtheria, as well as meningitis, pneumonia, types of pneumonia, lots of different things. So there's many that we cover in the early schedule. Then the children are invited again at the age of 1. Some children will be invited at 18 months, which is a new part to the schedule, which came in July. And then they're invited again at 3 years, 4 months, and that's the early part of the childhood schedule, then as teenagers. But I would always say, if anybody's unsure what their child is due, please contact your health visitors or your GP surgery, and they will be able to know and tell you exactly what they need. It's also worth pointing out 1 year is when they have their first measles vaccination, which is very, very important, especially to give to as many people as possible.
Indeed, and those vaccines are very important in many different ways, shape, or form, because these are the building blocks which normally comes in that way. So and definitely when we come to the second half of the show, we will discuss more about flu vaccines, but as well, do flu vaccines also be given as a part of those vaccination sections now?
So children routinely are from they're 2 to 3 year olds that we start giving, but also if they're age 6 months and they're in an at-risk group, so they've got some illnesses going on or health problems, then those children will be eligible from 6 months old for the flu vaccine.
And nowadays we can give kids both vaccines as well as the nasal drops as well, isn't it?
Yes, yeah. I didn't know if you wanted to talk more to that in the.
We will catch up on that part later on when we come on the flu vaccines topic. But yeah, I will just literally touch bases on that. In regards of diseases, some of the diseases the vaccines protect against are not common anymore. So, do children still need vaccines, Mike?
Yes, they absolutely do. And the reason they're not as common anymore is because vaccines work so well. And in countries where those vaccines are not given, or areas where the uptake of those vaccines isn't as strong, that's where outbreaks occur and people are unwell. So it's really important that we continue to say yes to vaccination. Vaccines are free. They protect children against a range of potentially serious infections like meningitis and pneumonia. So yes, please carry on saying yes to vaccination.
Yes, indeed, and it is very important because these things these things do save life, and sometimes people do have their own way of seeing things in terms of vaccines, but in general, I have seen that it does make difference, and one of those things were being highlighted more during COVID when during COVID we were almost in a awkwardly lockdown stage, and it was only able to lift it off when we start getting vaccinated. So vaccines do save life in many different ways. Am I right?
Oh, you're absolutely right. Yeah, vaccines have been responsible for saving millions of lives around the world. They're one of the most effective things that we can do to keep healthy and fit. So yeah, absolutely. Vaccines are very, very important. We should carry on saying yes to them.
Yes, indeed. So, Rachel, what happened if the babies? Let's talk about babies because babies are very cute, very cuddly, nature's gift. So, what happened if a baby is born early? Do they need to wait until they are old and grown before they starting to have their vaccines, or can they have it then? And if a child is older, then when can they have vaccines?
So, if you have a premature baby, so a baby born early, if they're very extreme and they're still in the hospital in the NICU, they will actually offer the vaccinations at 8 weeks of age in the NICU or the hospital unit. Likewise, in the GP surgeries, we would always encourage parents to come forward with babies when they reach 8 weeks age. From when they were born, so not corrected age for premature babies. I know it's a little bit confusing, but when they are 8 weeks old, they can come forward for their vaccinations as normal. And it's better to protect them because they are actually a really vulnerable group, and it's much easier for them to catch these diseases and have worse side effects from the diseases. So it's definitely worth them coming forward at 8 weeks. However, if you as a parent do decide to delay, it's always an open offer in the NHS. So there are some vaccinations that do have a limit of age due to safety. But generally, if you're unsure, please come forward for them, and your nurse or doctor will be able to guide you on it. But there's no upper age limit to trying to find out more or to get your child vaccinated.
So for those children, if a parent have missed their kids' vaccination because they are traveling or they missed it for X, Y, and Z reason. So what they need to do, they just go to their GP surgeries and ask for it, or have a word with their GP or practice nurse about it, or do they have to go to a community hub where they can get these vaccines?
So we do have some community hubs, but we'd always say try your GP surgery first. That's the best port of call. They're the ones that will sort of have access to the records and be able to offer. So please, any age can go to the GP, and somebody there will have a look at the record and tell you what your child needs and when, and talk you through it.
So now, whenever it comes to safety, being a parent, I know I really love my child to be safe and secure, and in the best care possible. And that's one of the reasons some of the parents who are a bit kind of concerned about when it comes to vaccines, whether it is good for their kids or maybe not. So when we say and this is a very common thing which most new parents who do not have kids before they become parents for the very first time, very common questions they raise in their minds or in GP surgeries, that how safe are the vaccines for the kids? So Mike, what do you say? How safe are these vaccines, especially
Well,
for
they're
children?
very safe. Yeah, they're very safe. Vaccines undergo very thorough testing, and they're
Hmm.
produced under very strict standards.
Hmm.
So certainly, I think that it's important that we trust vaccination, and we know that the vast majority of people in this country have very positive views about vaccination, and they trust vaccination. It's certainly a lot safer
Hmm.
to become immune to these infections through vaccination than by catching these infections. Some of them can have really nasty complications and land you in hospital. As I saw when I was a children's doctor, I've seen people come into hospital with some of these nasty infections, which could have been prevented through vaccination. There may be some occasions where you're advised to temporarily postpone having a vaccination, like if your child is really poorly under the weather with a high temperature, you might just be asked to just wait a little while until they're better again to get the vaccine, but still important to ensure that it's given.
Do you like to share any such cases which you have come across?
I can think of a
With
few examples. I can think
Yeah.
of a young child who had whooping cough, also called pertussis, who was really quite poorly and ended up needing to go to intensive care. It can be really, really nasty, not like a sort of cough and cold. Some of these
Hmm.
things can turn into really nasty infections, so really important that we prevent them where we can.
Wow, wow, wow. Okay. Yeah, exactly. And that's become a very, very nightmare for parents. I know, because back in Pakistan, polio is still one of those things which is a very live problem. Alhamdulillah, in UK we do not have that, but in Pakistan we have seen that if parents who have not given their kids the polio drops, they may end up getting polio later on, which is again a life crippling issue or problem for their kids, which is, yeah, which is devastating, which is devastating. Alhamdulillah, we do not have that, and that's one of the reason those childhood vaccinations. So, what does those vaccines consist of? Is it um, what vaccines are there in the childhood sections which we have given?
Do you mean in terms of which vaccines are
Yes.
given when? There are lots of different vaccines given at different times. As Rachel was mentioning, there are vaccines against conditions like pneumonia, meningitis, hepatitis, also measles, which is really important that we protect against, because measles can have all manner of complications linked to it, and it can have nasty complications. Children can end up in hospital, and the measles vaccine is perfectly safe. So we certainly recommend that everybody should take up that offer.
So, what about that sad story in the news about children with the measles? Can you tell us more about it? And is measles vaccine created that, or how does it all happen?
Well, yes, that there have been some sad stories with people being affected by measles, and in not just in this country but also overseas. Something that I think is really important to know is that measles is incredibly infectious. It's very easy to catch measles, and just to give a bit of an idea of what that might look like, if you imagine a community together where nobody is vaccinated against measles, and then one person has measles within them. That person will, on average, go on to infect between 12 and 18 people. And then each of those will go on to affect another 12 to 18, and so on and so on. So you can just get an idea for just how infectious measles can be. And it can lead to pneumonia and all manner of other complications. But thankfully, measles is preventable. There's a very effective vaccine that's given twice. It's given at around a year of life, and also at around 3.5 years, so that there's maximal protection from it. And it's perfectly safe, repeatedly proven to be safe over and over in countless studies. We really want to highlight that that's really important, and we recommend everybody is vaccinated against measles.
And this is given on twice, on once on first year, and then 3.5 years. Correct?
That's right. Yes, exactly.
But that is
Wow.
changing. Sorry to interrupt. Just for some children, will be invited for that second one at 18 months of age rather than 1 year. But it's a little bit complicated as it's a new introduction to the schedule. But I don't want anybody being alarmed that their child's been invited early. So that will be the case from January.
Yeah, exactly. And these kind of things do protect our kids, especially if they are going early in the nurseries, or sometimes parents do have to put them under plain stay areas because they're working parents. So it protects your child, and as Mike said, that it gives that extra protection, especially from the other kids who may get infected. So it can give you that kind of a protection. And if your child do catch measles even after vaccination, the effects of that will be very less. Am I correct, Mike, to say that?
Yes, absolutely. Yes, the measles vaccine is very effective at preventing severe illness from measles. There are some people who are more susceptible to the complications of measles, such as young infants, pregnant women, and anybody with a weakened immune system. But important that all children take up the offer of measles vaccination. Important that we prevent that as much as we can.
Indeed, and it is very, very important. Now, Rachel, one of the things which majority of the people think about is the MMR vaccines, and there was like a few years ago, even now, sometimes people think that it contained pork, and then that's one of the reasons parents sometimes choose to have one which doesn't contain pork. Is it true that it has pork contents in MMR?
Yes, so the main MMR vaccine given does contain pork. However, all GP practices have access to order and should keep a small stock of the vaccine that does not contain pork, and that can be requested by any parent. They don't need to really give a reason. They don't need to go into it. They just say, I would like the non-pork MMR, and that will be provided for them.
Wow. Okay. Yes. Because on the other day, it was a very bit kind of an eye opener that MMR vaccines have pork, because pork gelatin. Because in past I thought, yeah, none of the vaccines have that, and only nasal sprays of the flu vaccine might have it. But yeah, as more and more information comes in play, that is a bit kind of an eye opener in that sense. So thank you so much, because it is. So if a surgery do not have these vaccines, what is the alternative there for those parents?
So they will be able to order it, and the minimum, I think it should be in the surgery within a week. So
Right. Okay.
they will
So
all have
like,
access to order it, yeah.
like for example, if a parent with their child end up in front of the nurse and they ask nurse, okay, has this contained pork, and the nurse says yes, it has, and we do not have the not pork option, you can either have this or not have this. You can ask them, or parents can ask them, nurses, to order one for them. Correct?
Yes, yeah. So they will be able to order it, and they should have a delivery. It's usually a few days. They've usually got a set day, so usually within a week they can then have that.
Okay. And on that note, I must say, wow, the time has passed so quickly, and we are almost on the verge of our first break. So when we come back from the break, we will talk a bit more about the NHS vaccination programs and where can people get the information from, and definitely we will talk a bit more about the flu vaccines and how effective flu vaccines are for kids. So stay tuned with us. We will be right back after these short messages. And Mike and Rachel, we will be with you as soon as the break over. So stay tuned. We will be right back after these very short messages.
Assalamu alaikum. In Luton and its surrounding areas, it is now time for Salat al-Asr.
लुटन और इसके मज़ाफ़ात में नमाज असर का वक्त हुआ चाहता है.
This azan has been sponsored by Ideal Properties. Contact us on 01582 72 1110 or log on to www.idealpropertiesltd.co.uk. Allahu Akbar, Allahu Akbar.
أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمد رسول الله أشهد أن محمد رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله
اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة وابعثه مقاما محمودا الذي وعدته إنك لا تخلف الميعاد.
Would you like to sponsor the Azan? If so, give us a call on 01582 481810 or email us on info@inspirefm.org.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all our listeners and good evening. Welcome back to the Health and Fitness Show. I'm Fahad Matin, your host for this evening, and today we are talking about childhood immunization and flu vaccination with our two lovely guests today, Dr. Mike Saunders and Nurse Rachel Turner. This program is broadcasting live today on 14th of August 2025 and the time just past 6:30 p.m. We are broadcasting this show for our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpenden, Bedford, Milton Keynes, and our positive airways reaching to all our listeners who are listening us on Inspire FM radio app, website, or viewing us via Facebook and YouTube live link. So good evening and welcome back. So before we went on break, we were discussing in detail about the immunization. So childhood immunization, in which we have discussed about the when kids can have the vaccinations, when are the best times, what kind of vaccines been given to them, why they're important, what are the side effects. We have also discussed, Dr. Mike Saunders have discussed some of the case studies of what did happen if a child did not had vaccines, and how these can safeguard them. Now, one of the things I do like to ask to both my guests today is the information where they can, where people can get those information. So, guys, firstly, welcome back to our show today. Thank you so much for coming to our show today and equipping all our listeners with this lovely knowledge about childhood immunization and flu vaccinations. But one of the things which I do want to ask both of you, that how can people get more information about vaccines for children?
Yeah, well, there's lots of really useful information out there, and we always recommend that people go to official sources of information for vaccination info. So you can get that from the NHS website, nhs.uk/vaccinations, or you could speak to your health visitor or get information from your GP surgery. Lots of really helpful information out there.
Indeed, and definitely your GP surgery is a very good port of contact. And yes, I know it's not easy to get your GP appointments from there, but you can always see your nurses, and that's one of the reasons we have best of both today in our show for everybody. Now, one of the common things which people are worried about is flu. Now, I do like to ask, what is flu? So let's start with you, Rachel. First, you explain, and then I'll come to Mike.
Yeah, so flu is a respiratory illness. It is spread and caught by droplets, usually in the air. It's spread from person to person, and it causes lots of symptoms which can range from fairly minor to very severe. But you may think of things like fatigue, so tiredness, muscle aches, headaches, runny nose, sometimes a cough, all of those sort of things. But severe cases of flu can actually be very serious. People can be hospitalised. It can lead to pneumonia. And yeah, I'll let Mike continue with that one as well.
Yeah, sure. Thank you, Rachel. So yes, it can be potentially quite serious. As Rachel was mentioning, people do end up in hospital sometimes, requiring care due to flu. And sadly, flu can also cause deaths and contribute to deaths each year. It usually is, of course, much more prominent around the winter months. Appreciating it's quite a warm day at the moment, but flu season is going to be with us really quite soon. It's really easy to spread and catch flu, and that's why it's really important that, just as we were talking about earlier on, that we take up offers of vaccination. And we recommend that children should have the flu vaccine every year from the age of 2 or from the age of 6 months if they have certain underlying conditions.
Yes, it is. Sorry. I was just having a clump of water. Yes, it is very, very important in that sense. And one of the problems with our weather, unfortunately, in UK weather, is that it works from one extreme to another just with a click of your fingers. 1 minute it's like 30 degrees or 35 degrees. Very next minute it swap it back to 20 degrees, and those kind of fluctuations does unfortunately give all those necessary symptoms which contributes towards the flu, unfortunately. So why is it important to have flu vaccine? Now that's one of the biggest questions people ask. Why do I need one? Do I need one? Why do I need one? Because and this is one of those awkward debates which was there before COVID as well, during COVID as well, and nowadays as well. So let's start with you, Mike, and then I'll jump to Rachel. Why is it important to have flu vaccine?
Well, the flu vaccination is recommended for certain people based on their risk of illness from flu or the risk of spreading flu to others, such as during their work. And the reason that we recommend the flu vaccine is for several reasons. One is to prevent the spread of infection. We know that vaccinating children is really effective at reducing the amount of virus that circulates in the community and protecting family members, including older people, from ending up in hospital from flu. Another reason is to stop people from being seriously ill from flu. If you have underlying conditions like heart disease or diabetes, kidney disease, as well as other types of underlying conditions, then you may be more vulnerable to the effects of flu. And by accepting the flu vaccination, it means that you're less likely to be seriously ill and more likely to have more of a minor type of illness, or perhaps not to feel symptoms at all. And the other reason is to ensure that our health service remains open and active for us for when we need it. When people are unwell and end up in hospital, of course, that applies some pressure on the health service. So if we pick up vaccination, that's one way of ensuring that the services are open and available to us no matter our need.
Indeed, and it is very important, especially in the if I just talked about the Asian household. Majority of the Asian household has a very big joint family system. Either they live together in one household, or they have a regular visit with their grandparents and auntie, uncles, and all those ones. And kids are kids. They are the spreaders, the best of the best spreaders, we can say. When they get infected, majority of the adults in the older ages, people or elders in the family, they normally get sick as well. So yeah, it is very, very important. So Rachel, is flu vaccine safe?
Yes, like all of the vaccines in our program, it is very safe. It's been tested and used for many, many years. The children's vaccine, that one's actually given not as an injection like most of our programs, but I think, as you've already said, that one is given as a spray up the nose. So it's even less uncomfortable for children than the usual vaccines because there's no needles involved in most cases. The flu vaccine cannot give flu. It's a common misconception that the flu vaccine will give people flu. It doesn't. There may be some side effects that mimic flu a little bit, but these will be mild and pass very quickly. So yes, to sum up, it is very, very safe.
Mm-hmm. You've already asked one of the questions which I was asking, whether it does give flu, because some people think that they have the flu vaccinations and now they are getting flu. So yeah, it's one of those things. So how effective it is, Mike?
The flu vaccine is effective in protecting against the common types of flu viruses, and children in particular are very good at clinging on to that memory that they get from vaccination. It's still important to ensure that they are vaccinated every year because the virus changes slightly every year and the vaccine is adapted to ensure that it remains offering that strong protection. But for that reason, children are vaccinated slightly earlier in the flu season compared to other eligible groups. It is still possible to catch flu despite having the vaccine, but the vaccine means you're much less likely to become seriously ill or need to go to hospital.
Wow, that is very, very good. So when you said that it has it changes every year, what do you mean by changes every year? That means that a person should have vaccine every year?
Yes, that's right. So if you imagine the outside of the virus as a bit of a bobbly coating on top, sometimes that coating can change slightly every year. And as a result of that, we keep track of the trends of the different strains of the virus and what that looks like. And then the vaccine is adapted accordingly to be able to vaccinate and protect us against the latest strains in circulation. So that's why it's important that anybody who's eligible for the flu vaccine keeps getting it every year so that they stay protected.
So one of the common things which people do ask, when should I get the flu vaccine? Now, when should one get vaccinated against flu, Rachel?
As soon as they're invited, We have a bit of a staggered start to the flu programme. So children and pregnant women are invited from essentially the 1st of September. However, it depends when the vaccine supplies have arrived in their practices. But then all the wider programme will start from the 1st of October. So we would encourage everybody that gets invited, please book an appointment. Your GP surgery or local pharmacy may be available to book earlier than the 1st of October, as in you book it. So book it for a date after the 1st of October and get that in your diary and all sorted and booked.
So if a person do not get invited after 1st of October, what can they do?
They can contact their GP surgery to check whether they're eligible and just discuss with the GP surgeries. There may be something that's not on their record, an illness or something that doesn't come through on their record that they may have been treated for elsewhere, or something that they might be a carer or a healthcare worker. So please do have a chat with your GP surgery if you're unsure, rather than assuming, and hopefully they can sort it out for you.
But if a person do not check all those boxes, i.e. they don't work for healthcare services, they are not a carer, they do not have any long-term diseases, but they still want to get flu vaccinations, where can they get the flu vaccines for them? And where the other people who are in that list or who are eligible to get vaccination, where can they? So where can both parties have the vaccines, the ones who really want to have one?
Okay, so pharmacy is your other port of call for your vaccinations. They may offer a private service. That's up to the individual pharmacy. So you could possibly pay if you want to have that protection, but you're not eligible under the NHS. That's down to an individual. But if you are eligible, you can also go to your pharmacy and have that vaccination done.
So what about children's? Because one of the things with children's is that you said they get invited. So when they are between the ages of 6 months and 2 years, they get invited from the GP surgeries?
So 6 months to 2 years is if they've got specific health problems and are more susceptible to flu. So they will be invited, or if their parent thinks they are, they can approach the GP surgery. And then the routine programme is for all 2 and 3 year olds if they were 2 before the 31st of August this year. So if they're currently 2, before the 31st of August, they'll be invited. But again, you don't need that invitation to have come through. That's just for your awareness. If somebody's not sure, please contact the surgery.
And what about children who are 3 years plus?
Mike, shall I hand to you for that one?
Sure. Well, children who are in school will also receive an offer of flu vaccination. Children can conveniently have the vaccine whilst at school. Most of them will have the nose spray vaccine, which is very effective. It's safe and it's very convenient and easy. But you can also choose to have the injected form of the vaccine instead if you wanted to, and that's given every year, both in primary school as well as in secondary school.
Mm-hmm. So one of the things which I've seen has changed recently was the vaccination itself, because I think so there was the reason with the nasal sprays, they have pork gelatin in them, correct? So can people or can kids get their vaccines without pork gelatin or the halal vaccines?
Yes, they can. Yes, that's right. Yes, so the nose spray form of the vaccine does contain a small amount of pork gelatin in it. The reason that's in there is because it's a stabilizer, so it's for the storage of the vaccine. That's why. But there is an injected form that can be given instead. And in a similar way to how we were talking about the MMR vaccine earlier, you can just simply ask for it. It should be available to you. It is preferred generally to give the nose spray because it is slightly more effective at preventing transmission for children, but still the injected form is effective. It's also safe, and you can just ask for it if that's your preference.
Right. Okay. So just a quick recap in terms of the places. So children's at school going age can get their vaccines from the schools. Children who are younger than that can have it from their GP surgeries, correct? And adults can go to either their GP surgeries or pharmacy, including the people who wants to pay for their own flu vaccines if they want to have one. What about pregnant ladies? Who do they need to speak to?
So they can approach their midwifery unit, so their maternity unit or midwife, who'll be able to advise them. Sometimes hospitals do provide on site or in community clinics, or they can go to the GP, or they can go to the pharmacy. So there's quite a lot of choice for pregnant women where they can choose. Just to go back to your point about the school-age children, if the child is vulnerable, so in one of those at-risk groups that we've been talking about, at any age, they can also go to their GP surgery. And that's because sometimes the schools programme takes a while to get round all the schools. So to avoid any delays, they can go to their GP surgery if they're in an at-risk group. But yeah, back to what you were saying, maternity, the midwives will know where they can access. So it may be community clinic, it may be pharmacy or GP surgery.
Okay. So in terms of the kids itself, do we know, because one of the biggest problem comes in play is from the Muslim household or from the Jewish household is the pork gelatin itself. Do school communicate with the parents that their flu vaccines which they're giving have a non or halal vaccines they're offering, or how can the parents approach their schools to say that, look, I don't want my children to have pork gelatin vaccine, can we have the non ones? So can they approach schools directly, or if the school says they don't have that program, what are the alternatives for them?
So they do have, I don't know the complete ins and outs of what's on it, but there is a consent form that's sent out to parents. So the children won't be called for their vaccine in school unless the parents have signed a consent form. Though in some older children where they're old enough to consent themselves, that works differently, but they can request it, and the school nurses do carry the pork-free injectable vaccine. So it can be given in school. We would encourage that, and the school team do also cover community clinics. So if they miss it in school, they will have catch-up clinics that they can go to, and they will have that injectable version. So if the parent's not happy that their wishes have been communicated across via school, they can also attend one of the community clinics.
And it is across UK. Any schools can do that, because I remember previously it all started from Luton. It was very focused into the Luton side, and then it grows through. So is it now across UK?
It is. It's now a national policy, so it's fantastic that it started in Luton, and the teams in Luton have been very, very helpful with that. It was a few years ago, before my time, but it did start as a small project in Luton and has now spread across the whole country and has hopefully led to lots more children being vaccinated. So it is now a complete national offer.
Yeah, I remember that. I was part of that program.
I thought you might be.
Yeah, it was started from one of the schools in Luton, made in all schools, and it was a complete pilot project from when the parents start asking about this thing, and when they delivered, it was a big influx of kids who managed to get vaccinated, and that's how the whole dominoes effect started. Now, Mike, I will come back to you in that sense. In regards of the flu vaccines, can flu vaccines be taken alongside with the with other vaccines, like the other vaccination programs? Because some kids normally have the childhood vaccinations later on as well. So can they have them together, or do they need to have on separate timings?
The flu vaccine can usually be safely given alongside other vaccines, and indeed the other vaccines we were talking about a little bit earlier in the show are often given in combination safely. We know when vaccines can be given safely in combination because of the research and evidence before they're actually used. So we can have that confidence that it's safe to do. If for any reason that's not safe to do based on individual circumstances, then you'll be advised about that. But yes, usually it can be given in combination safely.
Wow. Okay. And on that note, I must say, wow, the time has passed really, really quickly. We are just under 5 minutes remaining to conclude our show. So can I ask both of you to give a quick recap of the first half, which we have done, which is immunization, childhood immunization, and the second half, which is about flu vaccination. So if I ask Rachel to start with if I ask both of you to to contribute on that and give a quick recap of the whole show, please, if you don't mind.
Yeah, well, I'll try and be brief. So there's a big sheltered schedule in the UK to protect against lots of various diseases. The key ones that we mentioned today included the MMR vaccine, so for the measles. There is the pork-free version of this available, just need to ask. And if in any doubt about what your child is due or what they need, please talk to your GP or your health visitor. GP surgery can also then provide the vaccinations. Mike, did you have anything to add?
Well, that was a good summary. Yeah, I think I'll just add that vaccinations are free. They're one of the most effective things that we can do to stay fit and healthy, and they protect against a really wide range of potentially serious infections. We know they work, we know they're safe, so we recommend people take up that offer of vaccination whenever they can.
Indeed, and it is very important to have the childhood immunizations to all your children, and even if you missed any of the vaccines or the immunization program, how old are the kids where you can still get it? Like, for example, if a person has missed their 2-year-old, 2-year-old updates, can they take it on 3 years old or so forth?
Yeah, they can generally have most of the vaccines. There are a few exceptions, but they're enough they can have that it's always worth asking and going through what they're missing with your GP or nurse. And then they will be able to update the child with their vaccinations.
Mm-hmm. And quick update about flu vaccines as well, please.
Sure. Shall I start, Rachel?
Yes, please.
So,
yeah.
So, well, flu can be potentially nasty. Is something for us to understand. It's not like the common cold. This can sometimes be serious, but there is a flu vaccination program. It starts from September for children and pregnant women, and then for other eligible adults from October onwards. And for children, they usually are given the nasal spray in most situations, but if you prefer the injected form, then you can just simply ask for it.
Indeed. And definitely thank you so much for you guys for coming to our show. Before we end the show, we always ask our guests to give positive messages and a message to encourage our parents and our listeners to have these programs. So let's start with you, Rachel, and then I'll ask Mike to give your positive messages.
Yeah, so these are very safe vaccines that have been well used and well tested. They are free, as Mike said. Please get your children vaccinated. The side effects and the effects of the vaccines are very mild in comparison to the diseases that we're protecting against.
Mike?
Thank you. Yeah, thank you so much. Yeah, thank you. And thank you so much for having us. I'd like to reiterate what Rachel was saying. We know that vaccinations are safe, they're effective, and we know that they protect us, and they're a really, really good way for us to stay fit and healthy. So I'd recommend vaccination to anybody listening.
Indeed, and these are those things. We are lucky to have these vaccines free of charge in third world countries, and many people who live outside UK, they have to pay for these vaccines a lot of money to get those vaccines. So on that note, I must say thank you so much for our both guests who managed to come to our show and give us a lovely advice about this topic. And if you have missed any part of the show, you can always listen back through our Facebook or YouTube channel, which will be recorded, or you can listen to our repeat telecast, which will be done on Sunday 6 p.m. Please do remember us in your du'as. Until next time, Assalamu alaikum. So thank you so much, Mike, and thank you so much, Rachel, for coming to our shows.
Thank you.
Thank you.
And until next time, I'm saying Assalamu alaikum to all our listeners. We'll meet again.